Topic is fluctuation test. Hello dear students, we will discuss the important clinical examination in a swelling, that is fluctuation test. So what is fluctuation test? It is eliciting the transmitted impulse in two planes, right angle to each other. So flex the swelling, press one side, then get the elevation. It is the displacing finger, it is the perceiving finger, displacing finger, pressing finger, watching finger or feeling finger. Always fix the swelling. Prerequisite to do fluctuation is fixing. If you have to fix, hold and fix the swelling with the fingers, then press like this, will displace, pressing, displacing, perceiving. Then do it in a two direction. Do it in two direction perpendicular to each other. Otherwise, we can't say that fluid is moving in the different planes, in the two planes. You have to elicit in two planes. You have to elicit in two planes. Otherwise, you can't say it is fluctuation. So, standard fluctuation, displacing finger, presses the swelling, perceiving, watching finger, feels the elevation, displacing elevation, two direction. It should be kept motionless, passive. The other finger should be motionless. Then it should elevate on its own. You are not doing it. Press, elevate in two direction. This two direction you have to perpendicular to each other. Previous test of fluctuation, a small swelling, fix the swelling, indent over the summit, you will get yielding sensation or fluid movement. That's in a small swelling, that is called as the Page's test of fluctuation. Again, MCQ question. In a small swelling, we will do it. And see that is a typical Page's swelling. Fix the swelling and indent over the summit or press over the summit, you will get the fluid movement. That is called Page's test of fluctuation. So, fluctuation suggests fluid content. Sebaceous cyst, it contains molding, dermoid cyst, then all cystic swellings, lymph cyst, so many cystic swellings which contain fluid. It contains fluid. Now, if it is fluid, whether it's clear fluid or not clear fluid, how to differentiate? Then you have to do translumination test and focus the light on that pen torch and see if it's a large swelling. Use the transluminoscope. In a dark room, ideally, you should do that. If there is illumination, which is identified with the transluminoscope, then it is transluminant. That means there is clear fluid. So, conditions which are swellings which are transluminant are meningocele, lymph cyst, cystic hygroma, ranula, like that. What hydrocele? Not many hydrocele, commonly hydroceles. So they are transluminant. So that's how we'll come into conclusion and clinical diagnosis. So fluctuant swelling, transluminant, and you got only few conditions which comes into picture. Then what exactly is the possibility? Then give a diagnosis. So once you do fluctuation, translumination is a must actually. Remember, that's important thing. So prerequisite is swelling should be fixed before eliciting the fluctuation. If you don't fix the swelling, you can't do. That's why abdomen mass, mass abdomen, you can't elicit fluctuation. You can't fix it. So in abdomen mass, don't tell it is fluctuant. You can't do it. So pressure exerted to a fluid transmitted equally in all directions. That's Pascal's law. So what law is used in doing fluctuation test is Pascal's law. That is again MCQ question. Pressure exerted into a fluid is transmitted. If you press here, it transmitted equally in all directions. So that is this principle is used to elicit clinical examination for fluctuation. Okay. So Pascal's law is the basic principle behind fluctuation test. That's why this law to be remembered. MCQ may be asked, Viva they may ask, Oxy they may ask. So other typical example, hydrocele is fluctuant in two, flex it like that, two direction, elicit in two direction. And all cystic swellings, whatever the type, is fluctuant. So remember fluid thrill for hydroid cyst. In abdomen mass, you can't tell fluctuation, but 3-finger test, fluid thrill only for hydroid cyst. Press it like this, then you'll feel the fluid movement, another thing. And a cross fluctuation, not in hydroid cyst, across an anatomical barrier. If there is psoas abscess across an inguinal ligament, then you press below, above, you can a bilocular hydrocele. Press below the external ring, then you can fluid movement in the inguinal canal. Compound palmar ganglion here. If you press here, you can get the fluid movement here across flexor reticulum. Ranula, press in the oral cavity, you can get a swelling here across. Wherever it is across an anatomical barrier fluid, same swelling extending with the fluid movement, then it is called as cross fluctuation. It is not the fluctuation, the different type of fluctuation. It is across an anatomical barrier. Psoas abscess, compound palmar ganglion, ranula, bilocular hydrocele. All these things are the examples which are given in my clinical book. Please go through it. So answer the MCQ. Compressibility is seen in lipoma, secretion derma, neurofibroma, hemangioma. Put the right answer in the comment box. I'll get you back later. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method, including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics, including briefly trauma, how to approach, orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis, but it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination, with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustrations photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is a principle, essential. After dissection surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topics, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, examination of the examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with the wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much. So please students, I hope you have understood this. I understood this session very well. Thank you so much.